Hello, everyone, and welcome back to the Digital Health Wire show. My name is Jason Berry, and I am the managing editor of Digital Health Wire. And I am joined today by Alex Lebrun, all the way from Paris, France. Alex is the co-founder and CEO of Nabla, one of the hottest companies and one of the hottest corners of the market, which is Ambient AI. Alex, it's good to have you here.
Thanks very much for having me today.
How's your day going? So far, so good?
Very good.
All righty. Well, I'm sure most of the audience is pretty familiar with Nabla, but for anyone who might not be, could you kind of give us an introduction to the work that you're doing and the company that you're building?
Sure. So Nabla is an AI assistant for clinicians. We realized 6 years ago that physicians, clinicians are spending more time on paperwork and things they hate to do, and not enough time on providing care. And nobody has studied 15 years of medicine to end up as working as a secretary. And we were in the field of AI we've been there for a long time. We founded two companies before, sold the last one to Facebook, Meta now. And we thought, okay, we can do maybe we can help clinicians to get rid of this part of their job. And so this is how we started to work on this AI assistant. We started with clinical documentation and shipped the first version of that almost 3 years ago. Because it was the number one pain point that clinicians were sharing with us. And now, starting from there, which is like a starting point, a wedge into the problem, we are covering more and more automations for our customers.
Mhm. It's hard to believe it's only been 3 years just looking at how quickly the space is moving and how quickly that ambient AI in general is just getting adopted. How's it been being kind of strapped to that rocket ship?
It's very interesting, especially when I think we started right at the right time, where some people had this vision a long time ago. I was with Nuance 10 years ago. We already had at Nuance this vision of what would become DAX, but we didn't have the technology to do that. So so startups who started with this vision back then had to involve human scribes in the loop because the machine learning component was not good enough. But then you build a completely different product and you start too early, and then it's very, very hard to change what you are doing. So some companies, I think, started too early. Many of them started too late. Once it's obvious for everyone, we should do that. Many startups are launching, but I think we were lucky to start exactly at the moment where the right technology, a little bit before LLMs, was starting to be available. And so it's funny to see that you are doing something alone in your corner. Everybody thinks you're crazy, and then suddenly it's so the train is leaving. And then last year we've been from January last year, I think we had our first production deployment for enterprise health system on the market, and it was really the first one for on the market, not just for us at Nabla, but and then 12 months later, it's obvious that every health system, every provider in the country either is already using it or is selecting an ambient AI partner. It's obvious. So in just 12 months, we've seen this speed of adoption that I think has never been seen before in our industry.
Well, what are the components that you think are making clinical notes and scribing really like the core AI early winner? What goes into that? Why is it so important and why is it such a good fit for AI?
So the technical component, two things happened. First, speech to text, voice recognition went from something that is very expensive, very slow, and full of mistakes. And so if you lose too much signal at this stage, then there is nothing you can do to recover later in the process. And the second component is our large language models and the GPT architecture. I'm not talking about ChatGPT, but the real breakthrough was GPT-2, GPT-3. In our case, there were a few problems that we could not fully solve with pre-GPT architectures. especially to summarize some information and understand, okay, is this something we should keep in the clinical note, or is this like small talk we should leave on the side? It's very hard to do that pre-GPT.
Right.
Again, I'm not speaking about ChatGPT, GPT-4, but the breakthrough was GPT-3. We were lucky enough at Nabla with our connections at Meta and at OpenAI to get access to this before it was released. And so we saw, okay, this is the final small piece we needed to reach a threshold below which clinicians don't care about your product, but because it's not good enough.
Yeah. I like how you refer to like Transformers as the final small breakthrough we needed. Yes, the greatest technological change in the last decade easily. Very cool. So Nabla, when you're looking at the clinical conversation, the information that's being exchanged with the patients and the providers, it seems like it's kind of standing at the gateway to a lot of the clinical conversation is kind of the core of a lot of downstream stuff. And that means that I imagine your product roadmap, you have this huge opportunity set of things you can pursue. How do you kind of narrow it down and select what to build next, what feature to roll out, and things like that?
So yeah, you're right. We like clinical documentation is a strategic keystone in the middle, because we sit in the medical encounter. We have the integration with the EHR, so we have the patient records. So we know we have everything, and we understand the context. And so based on that, there are many workflows we can help with or automate, starting from there. And we clearly see documentation as a beachhead, the initial wedge, and we already have started to expand very quickly beyond that. So now we have lots of candidates. Should we? There is a clear track into revenue cycle management, because coding is very, of course, important for providers. I mean, revenues are important, so coding is important. And if you don't have the right documentation, you don't have the right coding, or you make the coding task very difficult. So this is the most obvious probably, um, um, next milestone in a roadmap. And this is one where CFOs are very interested.
Mhm.
Something else we've seen last year, the change is, last year it was really cool for providers, for health systems to adopt AI, because they had to do it, and their physicians were not happy, burnout. So there was a special wild card where even if there is no clear ROI, it's okay, we will do these projects with ambient AI. But now it's different. I think with a new level of maturity, finally health systems are expecting like hardcore ROI, not just that providers are happy, but
Mhm.
they want to see the financial return. And that's another reason why revenue cycle management and so coding and clinical documentation integrity are very important in our roadmap. And how do we decide? We listen to our customers, and then we do a lot of work, because if you just listen and implement everything everybody wants, you end up with a very complex system that nobody can use. I almost said you end up with an EHR, but so it's very important. Part of the success of the product is it's very simple, very easy to get started. You don't need a tutorial, you don't need a training, it's very important, or we will lose adoption and engagement. And so on one hand, you have to listen to everyone, and the other hand, you have to make sure you still have a consistent and simple user experience. So
Mhm.
it's an everyday tension between these two things.
And you mentioned that one of the things that's been driving the adoption is that clinicians were just calling for this. They're burnt out, and documentation, after work pajama time, is a huge driver of that. Is that the core metric that you use? Are we slashing documentation time by X amount, or what other kind of North Star metrics do you use to guide whether the product is working, whether your customers are happy? What are the things that you're looking at to keep tabs on that?
So we measure adoption first, provider adoption. So in every customer, how many out there clinicians are using the product and how quickly it grows. This is the number one KPI. And if they save time, if it's working well, if the product is simple to use, then adoption will grow. Some people say all scribes are equal, and we say no. And this is the small like details, which are not details like you mentioned, makes a difference between a good product and a bad product. Is the output simple enough that you can actually check it quickly without spending too much energy or time?
Mhm.
How many mistakes do you do? So more than 95% of our notes are submitted without any edit. So these things that appear like details actually makes a difference between I spoke about the threshold. Clinicians have very high expectations and rightfully with this kind of tool. And if you're just below, it won't work. So
Mhm.
it's very important.
Yeah, that last 1%, especially in medicine, is so important. Like I'm sure all scribes might be equal transcribing this conversation between us, but when you get into talking about really complicated diagnoses and like medication names, it's like that last 1% is like 90% of the whole picture.
Yeah, and also if you just want to generate a text, raw text note, it may be okay to have something not perfect. If you want actually to generate the best coding, or if you want to trigger an order, or if you want to communicate something to the patient based on that, then the margin for error is much, much, much
Right.
smaller. You cannot get it wrong. So I think doing a generic scribe that works like what you would use in Zoom to summarize is not that difficult anymore in 2025. But getting something that outputs structured and very reliable data that you use for downstream workflow is much, much harder. But this is what we need to do, what we are doing now.
Mhm. And what advice would you give to provider organizations or health system leaders in the audience that are thinking about implementing ambient AI or weighing their options? How should they go about making a good decision?
First thing, speak to your peers, to people who have actually implemented it. I think the level of learnings you can get and make the right decision, go faster, is huge. It's still very new. So just talking to people who have done it a few months ago will save you maybe 50% of your time and avoid the common mistakes. And not
Mhm.
just to select the right partner, but also to have the best strategy to roll out in your organization to maximize adoption, ROI. So I think it's more important than reading some marketing. Um, the other thing is pilot. The good thing with this class of product is it's very easy to pilot. It's very easy to select 20 clinicians in your organization and have them try for 3 weeks, and then survey, ask them. There is a two advantage in doing that. First, um, it's you will select the best partner like that with by trying the product. And second, these physicians who do the pilot typically become, they love the product, they love the project, and they become champions. And so when you roll out the product to the full organization after that, they are very important for a successful rollout. So there is two advantages in doing a quick and simple pilot.
Mhm.
And I think nobody should, including with different vendors, if you don't know which one is the best for you. And I think everyone should go through this kind of pilot. Yeah, and the third thing is we shouldn't forget that these ambient AI products are doing maybe 5 or 10% today of what they will do in 2 or 3 years or 4 years for us. So it's really the beginning. Imagine you are selecting a partner to do your website in 1997.
Mhm.
It was just the beginning of the internet, and you're not just releasing something, it's static, it's done, and you won't change anything. It's just the beginning of a long journey. It will
Mhm.
evolve very quickly, And so I think working with a partner who is flexible, understand your needs, and you are willing to work for a long time with them together
Mhm.
is very important because it's not an accounting software or something that is static and won't change a lot.
Mhm.
It's a very, very first step only.
That's a great point, and it's my impression that Nabla works very closely. I know you partner with a certain children's hospital, and you worked with them to kind of pediatrics is just a tough space for the nature of the conversation and and whatnot. Is that something that's like pretty standard with Nabla implementations that you're constantly getting feedback from your customers and users and implementing that into the design?
Yeah, always. And we are we have a very close loop between our engineers and customers. Our engineers are spending a lot of time in person, attending medical encounters with our customers, and so our customers love they have direct access to this, and our engineers are incredibly motivated and efficient because they see how the product is used by themselves, and they want to work as a lot to make it better.
Right.
So we have this strategy of having a very short loop. Um, and so it's great you mentioned pediatrics. It was very, very difficult to support that well. We worked a lot with CHLA. It's pediatrics. Sometimes you have two parents in the room, one physician, two siblings, children, one interpreter. Half of the encounter is in English, the other half in Spanish. People change language in the middle of the sentence. It's it's incredibly complex, and we made it work, because because we really wanted to make it work. So there is always a solution. And again, we should be very humble that we are not selling a product that is done. We are just at the beginning.
To follow that up, this one's a little bit of a change of pace question, but while I have you here, I have to say you are one of my favorite follows on LinkedIn because you are very much building Nabla in public, sharing the trials, the tribulations of moving the company towards a brighter future right here. What goes into being a good leader of a company like that? What goes into creating a strong company culture? And just driving that mission. How do you think about these things?
I think one of the most important thing for us is to be very lean, a lean company with not hundreds of people, and the reason for that is not just financial. It's also to adapt very quickly, as we said, as everybody knows, this field is going so fast. It will really evolve super quickly. Roadmaps will change, priorities will change every time. And to be able to take these turns very quickly, you need to have a team that is not too big or with many middle management intermediaries, or political or too many processes. If you have such a company, it will be very, very hard to quickly adapt. And we know that in all the AI fields, speed of adaptation will be key in the future. So I'm trying to build a company which is growing fast because we we are growing, but that stays very lean. And to do that, I think the most important aspects are being very transparent internally with the team. Every single person should understand the vision, the mission, what are the priorities, so that they can make decisions by themselves without being supervised and micromanaged by, and then you have too many layers of management. Everything becomes very slow, and one day you're dead. So transparency is very important, and accountability, so that everyone, again, it's a matter of not having too many layers of controls. If everybody is very accountable, you don't need a lot of supervision, and so you go much, much, much faster. And
Mhm.
so I'm working every day to make sure we are very efficient. Um, I remember at Facebook we were saying every company will become old and slow and political. It's a
Mhm.
it's a process you cannot avoid as you grow, but you can slow it down. But
Hmm.
to slow it down, you need to work every day on this to hold it. And I think this is true for every scale of startups. And this is clearly the role the leadership should one of the roles the leadership should have.
Well, I hope that you can fight off growing old and gray for as long as possible. Along that path, and this might be a good question to wrap up on here, but if you executed on everything that we've been talking about to a T, you hit all the milestones and you executed flawlessly over, let's say, call it 3 years, which is a very, very long timeline in this space, particularly. I don't even know if we can predict out that far. But if over the next couple of years, if you executed perfectly, what would that success look like for Nabla?
So if we are successful, 3 years from now, clinicians won't have any paperwork to do at any time, and even beyond that, they will never have to use or look at their computer anymore.
Mm,
That would be a good test for no paperwork. Is you don't have to log in on any computer. You just have your phone on your pocket with your AI assistant, and you're looking maybe a headset, and then you're looking at patient providing care. Everything else you can completely forget because your personal medical AI assistant is there with you. Maybe it will be 4 years, not 3, or maybe 5, but this is really for us the measure of success, long-term success. Would be that they can just forget about their desktop computers.
hmm I love how you went. I think it's very telling that you went straight, not to we will be doing X dollars in revenue or we will be in X, Y health systems. You went straight to the clinicians and you said, if we're doing our job correctly, their life will be better. So I think that's great, great answer. Great note to end the show on. Alex, it's been great having you on. Thank you. Thank you for the time. It was a pleasure speaking with you.
Thank you so much, Jake, for your invitation.
Yes. All right, everyone. That's been the Digital Health Wire show. Thanks for tuning in, and we'll see you next time.